Welcome back to another presentation by the Sexperts. I'm Mary, and today in our STI series, we're going to be discussing HPV. HPV stands for human papillomavirus, and it is a viral STI. HPV is the most common sexually transmitted infection. It has more than 100 different strains, and 40 of them affect the genital area. HPV is transmitted from person to person through unprotected vaginal, oral, or anal sex, even if a person has no symptoms. Additionally, it can be spread through genital skin-to-skin contact, as well as kissing. Because HPV is a virus, there is no cure for it. However, in many cases, it goes away on its own with no serious health consequences. But it can stay and cause problems like genital warts, or even cancer. Genital warts usually appear as a small bump or group of bumps in the genital area. They can be small or large, raised or flat, or shaped like cauliflower. A healthcare provider can usually diagnose warts by looking at the genital area. Genital warts can be treated by your healthcare provider with prescription medication. If left untreated, genital warts may go away, stay the same, or grow in size and number. Cancers that a person could develop from HPV include cervical cancer, cancer of the vulva, vagina, penis, anus, and even throat cancer. Symptoms can occur years later after an initial infection, making it hard to know when you became first infected. Additionally, if you have a cancer strain, it may take years or even decades for cancer to develop. There are a few ways in which you can protect yourself from HPV. First is to get vaccinated. The HPV vaccine, also known as the Gardasil shot, is safe and effective. It protects against 9 of the strains, including 7 that cause cancer and 2 that cause genital warts. The CDC recommends HPV vaccinations at ages 11 to 12 and up to 26 years old, if not already vaccinated. The second way to protect yourself is to use a condom or other barrier method every time you have anal, oral, or vaginal sex. However, it is important to remember the HPV can be spread through skin-to-skin contact as well, so areas not covered by condoms and dental dams still pose a risk of transmission. Third, get screened for cervical cancer. Routine screenings for ages 21 to 65 years old can prevent cervical cancer. Screening is important because cervical precancer can be treated. Women who get routine Pap tests and follow up as needed can identify problems before cancer develops. Other HPV-related cancers are also more treatable when diagnosed and treated early. So how common is HPV? There are about 43 million current HPV infections in 2018. Many of these infections were among people in their late teens and early 20s. About 13 million of these 43 million were new infections. HPV is so common that almost every person who is sexually active will get HPV at some point in their lifetime if they don't get the HPV vaccine, which is why it is important to protect yourself every time you have sex. So what is the best way to protect yourself? Be abstinent, wear a condom, get cancer screenings, and seek treatment as needed. Want more information? Check out the CDC website to find the most up-to-date information on STIs. Also, reach out to the ACR Health Cap Health Educators, aka the Sexperts, at 315-415-6041, or your local health center to set up an appointment today. If you have any questions, please comment below or contact us on social media. Please like and subscribe for more videos on sexual and reproductive health.